Healthy nutrition helps to cure. The importance of dietitians' nutritional intervention and follow-up in dealing with the COVID-19 virus for patients and the healthcare staff. The spread of the coronavirus has placed extraordinary pressure on hospital wards. You, the medical, nursing, and logistics staff who treat corona patients, bravely transcend personal concerns and devote yourselves to saving lives. During this time, it is essential for us to remind you about the importance of adhering to a healthy diet. For the patient, healthy nutrition is critical for their recovery from the coronavirus. For you, the therapist, healthy nutrition will help maintain your immunity and prevent you from getting the disease, as well as helping you cope with stress. When we talk about a patient who has good nutritional status, we refer to the idea that the patient is consuming the right amount of energy and nutrients for his age, gender, and medical condition. Consuming a healthy diet significantly contributes to the patient's physical recovery process. The dietitian plans a personalized nutrition plan for each patient in order to adjust the diet to his needs. The dietitian monitors the nutritional status of the patient and makes dietary adjustments when needed. The coronavirus causes loss of appetite, taste, and smell in the patient. These greatly affect the variety and amount of foods the patient is ready to eat. The result is a decline in the patient's nutritional status. Nutritional deficiencies weaken the patient's body and ability to successfully cope with the challenge of fighting the virus. This coping sometimes involves interventions such as high-dose medication and artificial respiration. In contrast, a patient in good nutritional status will cope better and recover faster from the virus. Monitoring the patient's nutritional status is very important. This enables nutritional interventions to be performed promptly so as to prevent a decrease in the patient's physical strength. The patient's condition can change rapidly during their hospitalization. This may require a change of food menu or route of feeding. In this case, a quick response from a dietitian is required. Improper feeding can worsen the patient's health and even cause death. Contrary to ordinary times, the need to isolate corona patients in the hospital does not allow direct contact of the dietitian with the patient. Her meeting or connection with the patient is based entirely on the information that is conveyed to her from the doctors and nurses who are with the patient at all times. By performing a number of actions, you can greatly assist the patient. Number 1. Be sure to document in the patient's medical record what the patient eats or drinks, as well as monitor their fluid balance. Number 2. Ask him questions such as, "Did you eat today? How's your appetite today? Are you having trouble eating, chewing, swallowing?" Number 3. Record his answers in the medical record. Number 4. Encourage the patient to update you about any difficulties with eating. Number 5. Assessment of nutritional intake and adjusting the diet in patients with illnesses such as diabetes, hypertension, obesity, or cardiovascular disease is critical. Pay special attention to glucose balance, urine output, and electrolytic disorders. Number 6. When the patient is ventilated, the dietitian has to intervene and adjust the nutritional plan according to the patient's changing medical status. And what about you? Did you eat or drink enough water today? Don't neglect yourself. Eat healthy to stay healthy. A properly nourished body will be more resistant to exposure from the coronavirus, generally function better with stress, and prevent disease in the future. Here are some tips for healthy eating during a shift. Number 1. Prepare your meal at home and bring it to work. For example, prepare a sandwich made from whole wheat bread with some fruit on the side. This makes for a healthy meal. Number 2. Try to eat at regular hours even during shifts. Number 3. Eat fruits, vegetables, legumes, and nuts daily. Choose chicken or fish instead of red meat for lunch. Number 4. Drink a lot of water, even if you don't feel thirsty. And number 5, during your breaks, take a short walk or exercise. We wish you good health and thank you for your cooperation.